Nick.
We have Nick here too. We'll let Nick say hi. Nick, come up here to the camera and say hi.
This is the man, the myth, and the legend.
Hello. What's going on, guys?
Hey, we're just getting ready to get started. I'm so glad you're here. So tell us about you.
What do you
want to know about me?
ProCare?
What can I answer for you? About me, I'm the owner of ProCare.
Yeah. So he's checking our support group out. He's the
I
one
was
who made
coming to
this
see
possible.
what was going on. I heard us talking about these packages that we're making that Erin designed. She did a great job on those.
You did, yeah.
Yeah.
So, yeah, pretty fun. So,
Well, he's the guy who made this
I'm getting ready to
possible,
go home, and I got to go coach some soccer.
Yay!
He's a coach on a different end.
I'm a coach everywhere.
Yeah.
He has 5 kids, so he stays busy.
Yes, a little bit. All right, guys. Well, have a good little thing you got going. Bye.
Thank you.
Bye.
Bye,
guys.
So anyway,
I'm going to minimize Erin since Erin's Erin, is that okay? Closing her video. She can still hear us. Oh, we forgot to, you know what? Let me invite her back because we forgot to get Jen on there. I'm going to invite her back. We forgot Jen. In the meantime, because we want to say hi to Jen too. She's one of our colleagues as well. Hopefully she'll be back here. There's Jen.
Jen.
How are you?
Let you say hi from ProCare.
Hi from ProCare.
Yeah.
She's
in the office. She's in Lake St. Louis is where our main office is, and so they're videoing from there.
Yes. From the office, yes.
And Jen's one of the people, if you call in orders or you have questions, she's one of your frontline people. She's there helping.
Yes, I answer the phones. I take the orders for customers, facilities, kind of do it all. Watch over shipping, whatever's needed, I jump in and do it.
Yeah. So be aware. Our staff, actually ProCare staff is fairly small. I mean, there's probably, what would you guys say, 15 of us, maybe? 15, 20?
I think that, maybe 12.
Yeah.
Yeah.
In office, maybe 6.
Yeah.
8. Mm-hmm.
So we're an intimate little group here.
We are, yes.
To support you. So thank you for saying hi.
Yeah,
appreciate it.
Have fun.
Thank you. And I'll take you guys' video off so that you guys can finish packaging. Thank you.
Bye.
Okay, and then I'll introduce myself. Some of you guys probably know me if you've joined our support groups before, just like Brittany. We were here before. Somebody says the connection is crap. So wonder what we can do to work on that. Maybe it'll get better since there's 2 of us. Is it the sound or the picture? And if you're not on Chrome, like if you have Chrome as Google Chrome.
I just asked him if he's using Google Chrome.
Because that may make a difference. We'll see here.
We're really sorry about that, Bill Greg.
We'll let him answer. So basically, I'm just here as, I call myself a life support coach. That's what I was hired on for. I'm a nurse. I worked for a bariatric surgery program as a bariatric coordinator for about 7 to 8 years. And through that program, I met ProCare and started working with them. Over the last 2 years, I've kind of done events with them, like vendor fairs and things like that. And then became full-time with their team here recently, just this year. So doing things like support groups and Facebook Lives and that type of thing. So some social media, some blog posts and things like that. So I'm just really here to support you guys. I actually also have a real passion for coaching. I got a certification in coaching, so kind of a unique little background. And I'm a bariatric surgery patient myself. So I had the sleeve gastrectomy back in 2013, and it's been an incredible journey for me. I feel like I've learned so much from patients and from all of you, because that's, so I just want to, I'm here to help share some of that and help network with all of you. So we're hoping that we have some others. We have about 10 now on our call. Some of you want to say hi and tell us who you are, if you've had weight loss surgery, where you're from, whatever you want to share. It's great.
Where you're from is always so interesting to me because last time we did this, we brought another person on screen with us, and she was in California, I think it was, which I thought that was so funny.
And we're hoping to be able to do more of that too with this call. He's Wi-Fi.
Oh, he doesn't have Wi-Fi connection. I'll tell him. So Greg, if you can hear, I'm not sure if you can, but I'll respond to that. These are, you guys, you can watch these later too. So if you cannot hear, you don't have a good connection or Wi-Fi at the moment, if you wait when you get home and you have a good Wi-Fi, you can replay them after.
Yeah. I also want to do a shout out while we're waiting maybe on some more people to join. I want to do a shout out. So we've been sharing with programs these links, and so I want to name some of those programs just to see if any of you guys are out there. So we have Boone Hospital in Columbia, Missouri. ProCare Health is actually based out of Lake St. Louis area, so it's not real close, but Columbia is a little hike up north. And then we have University of Florida. We have with them, we have Alba and Gwen. We've actually done several support groups with them already, just one-on-one. So if anybody else wants a one-on-one support group, we can do that. We have invited North Shore, Chicago Institute of Advanced Surgery in Chicago, Illinois. We have invited SSM DePaul in St. Louis, Missouri. We have from that facility relationships built with Patsy, their program director, and their dietitians. We have New York City Health, Harlem Hospitals in New York City with Michelle DeRochers. I hope I'm pronouncing that right. We have Cleveland Clinic in Twinsburg, Ohio with Beth. We have Mercy Hospital Lakefront, Chicago, Illinois. I'm going to go through some of these kind of fast because we have so many. We have Nutrition Solutions in Beaumont, Texas with Kelly. We have Children's Mercy in Kansas City, Missouri, and I'm super excited with that. So raise your hand if you're with them because we actually have a group of, they actually do surgery on bariatric kids, on children or teens and young adults. So that's I'm excited to have them on. We have Mount Sinai in New York City, Surgeons of Northern Illinois in, let's see here. I have some of my places covered up, so I apologize on that. It's Illinois. North Kansas City Hospital, we have Natividad. I'm not pronouncing that right, I'm sure, but Medical Center.
I don't know either.
And that is Michael. If he's here on the call, he joined us with our last one. Say hi. We have Columbia Surgical Associates. We have Bariatric Regional Assessment and Treatment Center. We have Rockwood Hill, GYN and OB, University of Illinois, Surgical Specialist of Cobb in Austell, Georgia, and Sarasota Memorial Bariatrics in Sarasota, Florida, and University of Kansas in Tobacco, Kansas. So those are just some of the ones that we've reached out to, and we're hoping you're with them. If you're with a different program, though, that's great too. We've been kind of promoting these things on some different forms of social media. So Julie said she's from Children's in KC. Hello. And then Brittany says that's awesome. And then we have Paula. She says hi from New York.
I think that's North Carolina.
Oh. Thanks, Brittany.
No, but I read it the same way when I first saw it. I was like, what? It's been a long day, guys.
She's a twin to me. She had surgery in 2013. So that's cool.
Oh, yeah. She got it the same year as you. Yeah.
Yeah. So anyways, so everybody else who's just joining us, feel free to say hi, and we're going to get started. This program can last anywhere from an hour, hour and a half. It just kind of depends on participation, and we just want to make it as beneficial as possible. The big things that we're going to be talking about here today is we're going to basically be combining the essentials of physical activity. So we're not going to really go into specific routines or anything like that. We're going to make this really a unique talk specific for you, wherever you are in your journey, because the biggest thing that sometimes we need is a little motivation and inspiration on what our next steps will be. Because I know for myself, I've not always been the most avid physical activity person. I'm just going to be totally honest. And I even kind of had to prepare myself for this talk because I'm like, I need to be doing something. So a little while back, I started trying to be a little bit more intentional about my physical activity. And we'll talk about some of the things, ideas that I had for myself. But, you know, with this year being as it is, it's just been really interesting. You have to be kind of creative because some of the places that we were used to going to and getting our physical activity aren't open. Now, Julie says, I'm an RD who helps kids prepare for surgery. I also had VSG in June of 2020. Ah, that's great. That's wonderful. So, thank you for telling us that, Julie. We appreciate that. And if you, one thing I want to say is a lot of the recommendations that we're doing come from just basic research into the facility. How can I say this? The ASMBS, which is the American Society for Metabolic and Bariatric Surgery. There's tons of research out there on what's good for bariatric surgery patients. So we're going to be kind of sharing some of that. We're also going to be, if there's program dietitians, nurses, other staff that are joining us, I'd love for you guys to give us input
Yes.
in some of these points. Right, Brittany?
Yeah.
And then also we're going to be talking about what the benefits are, because really and truly, why do something unless there's a benefit? And then helping develop your own plan of action. So that's a big thing if you're new to this and getting started. So that is kind of an introduction. What you're going to kind of see us do is a couple things. So Brittany and I are going to be on screen, but I'm going to be sharing my screen at some points. And Brittany, if you have anything at some points that you want to share, you're welcome to do that too.
Okay.
So I'm going to kind of start. You're going to see our screens kind of change, and you're going to see a little slideshow, and we're going to be going kind of off and on of that. And also we have handouts, and our handouts are going to be accessible, while we're doing this. Just here on the program, we're going to be showing some of those notes. But there's a link that we shared a while ago at the very beginning. If you look at the chat box, it was a link it says https://ProCare.com support group handouts. And that's a link to go directly to the support group handouts. Now, also on our website, I'll show you where those are. I'll kind of minimize my screen here just to kind of show you, share screen. And I'm going to go to show you right now where you can go to get handouts. So you can get them. Are you seeing my screen now?
Yep.
Okay, so it is under, I believe, resources. They may have changed this, or about us.
Is it under events?
Maybe.
I went ahead and posted the link again too,
The
for
direct
people
link?
who maybe just have came in.
Okay, well, sorry about that, guys.
Oh, she said go back to the homepage.
Okay.
About
So
us.
you basically have to go down to the very bottom here where it says home.
Well, no, go to the About Us.
Oh, about us?
Yep.
About us.
And then click the logo, it says.
Right here?
Yeah. Or maybe scroll down. Click the logo to go home. Okay.
Okay, click the logo to go home, and then the handouts are right up here under About Us. I wonder, they don't show up all the time, though, I guess. And then, so you're going to see here, it looks like they got them loaded. And today is this physical regeneration, and you're going to have 4 different handouts. So if you decide to follow along on the handouts on your own, you can, or if you just want to access them later, because we're going to be pulling them up. So I'm going to go back to our main screen. Actually, I'm going to go back to our main screen, and then I'm going to go to our slide presentation to kind of get us go on and started. So while I'm doing that, I'm going to talk about why did we pick this topic? Anybody want to guess? Brittany?
Why'd we pick this topic?
Yeah. I put you on the spot.
Honestly, if I had to guess, it's because you're trying to retain muscle.
Yeah.
Maybe.
So
you don't want to lose muscle with all the weight that you lose after surgery, and maybe it can be challenging to do that.
Absolutely. That's
Was I right? What do I win?
You're spot on. So basically after weight loss surgery, and really just lifestyle wise, weight loss surgery is basically, it helps boost your physical strength, boost your energy levels, helps you reduce stress. But for bariatric surgery patients, one of the most important things, what I will say is that, as you lose weight, it helps with toning too as well. So I'm going down. I'm sorry it's taking me just a moment here, guys. I apologize. I'm going to share actually my entire screen because it's not allowing me to get down into my PowerPoint for some crazy reason. So that being said, I'm just going to share my entire screen for just a moment. And I'm going to go down. Share entire screen. Okay. And then what's going to happen is you guys are going to see me here go into my PowerPoint that way. Can you see it?
Yep.
Okay, so we are going to, first of all, I want to just say, and Brittany, I'm going to let you look at comments because I can't access them.
Yeah, no, I'll interrupt you if there's any comments or questions or anything. So also, if you guys have any questions, I put it in the chat box, but you can either ask it in the chat box or you can click the ask a question button down below where it says polls and people. And you can ask a question that way, and we'll be sure to answer it too as soon as possible. So
wonderful. So, and if we have any other programs on here, one thing I do want to say is, when you're getting ready to have weight loss surgery, or maybe you've already had it, most programs have a lot of information that they give to their patients and kind of help you with your journey. And so, one thing is, what does your program recommend? Is there a certain number of minutes per week? And we're going to talk about general recommendations, but if I have any programs out there that want to share, number of minutes per week, days per week, types of physical activity, and I say exercise, but really I just mean moving in some sort. So I'll give anybody a moment to see if we get any responses on that. Can you tell me, Brittany?
No, I don't see anything just yet.
Not yet. Okay, we're going to kind of keep moving. I guess if there is something that anybody out there who works at a program, or maybe you were given information and you want to comment, you're welcome to do that. The basic recommendations on physical activity, what I did is I pulled up the American Society for Metabolic and Bariatric Surgery just to kind of go straight to the point of, what is recommended. So what I'm going to do is kind of go to that handout. Let's see here. Let's see, recommendations. This one. Okay, sorry about that. Can you guys see this? Mm-hmm. The physical recommendations handout.
Can you zoom in maybe just a little bit?
Sure.
That's better.
And I don't really expect you guys to have to read this. It's basically, this is going to be available for you after this program. And so I just want to let you know what's on here, and then we'll kind of head back to being able to just kind of talk. So basically, before surgery, so this handout just kind of outlines before surgery, after surgery. Before surgery, you can even start some physical activity if you're able to. Some people are able to, some people aren't, depending on your health level, beforehand.
Everybody's different.
Exactly. So if you are able to, 20 minutes a day, 3 to 4 days a week, could be something very mild like walking, or just gardening or something like that. Something that Gardening can be hard though sometimes, but just whatever is kind of aerobic conditioning and light resistance training. For post-surgery, I'm going to kind of skip down. There's like, I was able to find all different kinds of recommendations from the Department of Human Health Services, Institute of Medicine, College Sports Medicine, all different kinds. But we're going to go jump down to this little graph here, and I'm going to highlight it, get it bigger here. And basically, that is, we're going to talk about this age group, children and adolescents. We're talking about adults, and we're talking about older adults. So they're basically pretty close to the same. With the children and adolescents, the recommendation is 60 minutes or more activity a day. With adults, it's 150, 18 to ages 64, and same with older. I'm getting really close to this age right here, so I'm not going to use the word older. I'm going to just say, what would be a better word for it?
Mature.
Mature audiences. At least 150 minutes a week, such as brisk walking or something like that. So really and truly, dividing these times up, you could do that. Like if it's 60 minutes a day is what it's recommended for you. If you can't do a whole 60 minutes, if you want to divide that up into 15-minute intervals and do it three or four times a day, whatever works for your lifestyle. And we're going to kind of talk about lifestyle in a minute, because that's really where it comes down to, being able to fit these workouts in. Now with children and adolescents, basically physical activities, if you're in school, there might be sports and things like that. So as a part of the 60 minutes on at least 3 days a week, children and adolescents need, it says, I'm going to kind of zoom in, vigorous activity that strengthens, such as running or soccer, activity that strengthens your muscles, and activities that strengthens your bones. That was probably one of the biggest considerations. I wasn't really aware, but I guess you're still, when you're that age group, you're still growing, and the physical activity also helps strengthen the bones and joints.
Michael in I'm sorry, I don't know how to pronounce that. I think it's Natividad said that we ask clients to work up to 30 minutes daily by the time of the surgery, and then 45 to 60 minutes daily post-op is what he says what they do at their facility.
Wonderful. Thanks for commenting.
Yeah, thanks for sharing, because it's kind of interesting to see what, different facilities have.
Absolutely. I know the program that I worked for before, we usually recommended, I think, 150 minutes and then strength training. And that's basically what we're going to kind of jump into now. Strength training is important too. So you get physical activity plus the strength training, and they're recommending 2 days a week. So if you were doing this, what it might look like is 3 50-minute workouts with maybe 2 days of maybe lifting weights or using resistant bands or something to that effect. And I also think like some forms of like Pilates and some forms of yoga and things like that might even be considered, I believe, strength training. And then older adults, basically the same, at least 2 days a week of strengthening muscles. And one other big thing with that age group is improving your balance, such as standing on one foot.
And yoga would definitely help with that, I would think, anyway.
Oh, definitely. Have you ever done yoga before, Brittany?
Oh, I love it. Yes.
Do you? I do too.
Yes.
I'm going to stop sharing that, and you're going to see me kind of come back to screen here. Can you see me?
Mm-hmm.
Okay. Okay, great. So we kind of talked about different levels of physical activity. The next thing we're going to kind of talk about here, I'm going to toggle my video and share my screen once more. I'm going to probably need to, it's going to allow me this time. I'm going to go back to my PowerPoint. And we're going to go down here to the benefits. And we kind of touched on these a while ago, but to me, why do you do something unless you have a good reason for it? I mean, let's be honest, our time is precious and our lives are precious. It's like, why should this be important to us? And Brittany brought up, what was your point that you brought up?
About
physical benefits. Like, what did you say earlier?
Oh, for just regaining muscle back, or at least keeping what muscle you have.
Yeah.
Is that what you were talking about? I'm sorry.
Yes, absolutely. And I think that's one of the biggest things. I know whenever I was working in clinic and working with patients all the time, one of the biggest things they were concerned about is sagging skin or, um,
Yes.
extra skin after surgery. And
Mm-hmm.
while everybody's bodies are completely different, one of the biggest things that you can do, because you don't have a lot of control necessarily over some of that, but one of the things you do have control over is your physical activity, and that can help you with toning and strengthening. Kind of tell you a little story here. We used to have a program in the program I worked at called Exercises Medicine, and it was a 10-week program working with a trainer 3 days a week. And whenever I did that program, I did it just to kind of try it out to make sure I fully understood the program and what it was about and all of that. And actually, I was interested in getting stronger myself. The biggest benefit out of anything that I noticed more than losing weight, more than toning, anything, was balance and strength. Like being able to stand on one foot, being able to bend over and touch my feet, or get on a one of those, they call them like the balls where you kind of like balance yourself and sit on them.
Oh yeah.
So yeah, just like simple things like that. I noticed so much more strength, and those exercise can help you do your activities of daily living, like the normal things that you do every day, like helping your children with things while you're working on the floor, or doing your dishes or mopping your floor. It helps build strength. So it also, one of the biggest things that people find is helping with weight management. And I already mentioned these others, so I'm not going to repeat that.
I feel like it
Anything?
also would help with energy too. You know,
Oh, 100%. So
makes you
when
feel a little bit more energetic and just a better all around.
what would you say when you first start an exercise program? What might people notice when they first start? I just want to bring this out.
Yeah, comment and say what you guys think. But for me, just from the past, I've noticed that it's kind of crazy because I sleep better for one, and it's normal hours of sleeping too, and I just feel more energetic too at the same time, like during the times that I'm awake during the day,
Mm-hmm.
and
Yeah.
your body just feels better, I think. It thanks you for exercising.
One thing that I can say though, is sometimes you will notice discomfort when you first start exercising. And
Oh yeah.
yeah, like sometimes it's actually a little bit of like muscle strain. You might feel like your abs being sore, your thighs being
Hmm.
sore, your arms. Um, and to help with that, what happens is when the muscles break down, it builds up lactic acid. And so to help with that, you can take Tylenol or something like that. Tylenol is usually pretty safe for bariatric surgery patients, unless, of course, you're allergic or you have some other reason you can't take it. And then also drinking lots of water, because that helps flush out all that extra lactic acid. And then extra stretching when you're first starting an exercise routine.
Hmm.
So I'm going to share my screen again. I'm going to go back to our little slides once more. And one thing we're going to talk about here is a handout that's going to talk about exercises specific to getting your results. So moderate activities versus vigorous activities, muscle strength toning, and that type of thing. So I'm going to go straight to that. Give me just a second here. Here it is. Head it. Can you guys see that? Types of physical activity and benefits?
Hmm.
Okay. Kind of make it a little bigger. And I'm not going to spend a whole lot of time on this because, again, this is a handout that you guys can refer to, but it makes sense. Like moderate activities could be things like walking, and that is honestly one of my most favorite things. Brittany, I've heard you say that that's probably one of on your top list too.
It is.
How about anybody else out there? Can they tell us what you like what is some of your physical activities? And it could be, we're going to talk about moderate, we're going to talk about vigorous, and we're going to talk about muscle strengthening. But what are some things you do? I mean, here for moderate, we have walking at a brisk pace, riding a bike, hiking, golfing, playing softball. We got yoga, we talked about that. Dancing. I love dancing. Not very good, but I love dancing.
Yeah. No, I don't
Especially
know
when
if
you're
she's a good dancer. I'm not saying you're a bad one.
um, home activities. We have all kinds of mowing the lawn, washing your car by hand, online access to fitness programs. And here in just a moment, I'm going to share some ideas about that because I just think that's kind of become one of my new loves. And vigorous activities, we have things like bicycling, circuit training, basketball, sports, that type of thing. And then more like heavy snow shoveling. Hopefully we won't have too much of that coming up here.
Oh my gosh, no.
Is it snowing anywhere out there? Anybody that's on the call? We'll see if anybody answers. And then we have down here muscle and toning. So we have with that, things like lifting weight, doing push-ups, using resistance bands. The resistance bands is something you can use at home.
Mm-hmm. Those are really easy to use too, and they're not very expensive on like Amazon or really
Oh,
anywhere online. They're really inexpensive.
thank you for bringing that up because nowadays Amazon, they're on speed dial for a lot of people. And then bone strengthening. So we're going to talk about the ages 17 years and up. So here we have things that create impact with the ground: running, jumping, rope, basketball, volleyball, hopscotch, gymnastics, and things like that. So I'm going to stop sharing here. I'm going to go back to our main screen and just kind of see if anybody has commented. I don't see anybody is listed their programs yet. I'm going to go ahead too. I want to share a couple ideas with you on activities that I think, like, especially since the whole COVID thing is going on around the world, things that you can do and stay safe. One of those things, I'm going to share my screen here once more, and I'm going to go to some tabs I have open. First of all, we have YouTube. Okay. So YouTube is free, and you can type in something like HIIT workout, which is high intensity training. You can find all different kinds of those. I'm sure there's probably thousands of them. So you could do that. You can do, let's say, yoga workout.
Mm-hmm.
Type in that and find all different kinds of strength training, completely free, and see what your level of physical activity is. Some of these workouts you can modify to be your own. One thing that I recently came onto was something called, I'm gonna close that out. Whoops. And I'm going to show you a different tab. So give me just a second. I have to stop sharing to share another screen. Sorry. I'm trying to apologize. Close video. There we go. Okay. Now I'm gonna share another screen, and I'm gonna show you another application that I found recently. So there's all different kinds of apps out there. This in here is called Daily Burn, and I am not by any means compensated for advertising for any of these programs. There's lots and lots and lots of them out there. We're going to talk about some other ones, but this is just an example. Like, they have daily workouts. It tells you how many calories you burn. This one's only 45. This must be a short little one. How many minutes. They have all different kinds of workouts, fit for the family, body weight beginners, total stretch. Some of their workouts are like 20 minutes. Some of them are 30 minutes. Some of them are 40 minutes or an hour. They have all different kinds of workouts. So you could actually do things like, you could select a program depending on what kind you want. If you wanted, let's say, yoga versus cardio versus, I did boxing one day, which was really fun. So that's one other thing. And I'm going to go ahead too, and I'm going to go back to our main screen because I also want to share, apologize here, kind of jumping around a little bit, sharing my screen.
Did you say that was free too?
That one is free for the first month.
Oh,
And
okay.
then after that, I think it was $19.95. But there's all different price ranges. Whenever I was doing research, let me pull up a little handout here that I found on accessory like resources and things like that. Let me do that. I'm going to do my entire screen again real quick because it allows me to get to all of my handouts. So I'm going to do this, and we're going to go down to resources. Whoops. Sorry about that. Resources. So can you guys see that? Resources for physical activity?
Yeah, I can see it.
You can see it?
Yeah, I can.
Okay, great. So some other types of things. We're going to go down here to where it says at-home workouts with support. You know, things like Planet Fitness. I mentioned YouTube because YouTube is free. That Daily Burn, Beachbody On Demand. There's like literally hundreds of them out there. When I started researching, I'm like, this is really, really overwhelming. But you know what? It's like it depends on what you want. You know, what your physical activity level. And most of the time they'll modify them based on your current level, because when you're first starting, the good news is nobody else, unless your family's with you, can see you doing these workouts. Have you ever done any online before, Brittany?
I've done a few yoga ones online, and I did a couple Zumba. I love Zumba too, which is it's like dancing basically. And it's a really good way to get the heart rate up, and it's kind of like cardio, really.
Yeah, and it's kind of
Um,
a little dance built in where you're kind of. I
yeah,
like the music.
I know, me too. Yeah, I haven't done those in so long though. Honestly, you're kind of piquing my interest with this daily burn. So once I would be very interested to see what that's like to try the
It
free trial at least or something.
Yeah, that's my daughter who is very much into working out. She's 22, and I'm gonna look here real quick. She said whenever you go on to today, I asked her about programs, you know, that you can use, and she said I'm gonna talk about some of these other ones, but she said I'll write these names down in here. Chloe Ting, free program on, these are all YouTube. Pamela Reed, MadFit. She gave me some suggestions. And again, we have no affiliation with these programs. And I honestly haven't checked them out. These are all ones she did. And I asked her, I said, are these ones that just generally anybody can do? Because her fitness level's a little bit, maybe more than mine. And she said, well, most of them have modified, ones. So I'll put those in the chat here in just a moment. I also just want to say I have a handout here, resources for physical activity. And I just want to mention some things like Bariatric app. Those are all for tracking. MyFitnessPal, Lose It, smartphone trackers, and the health app. It's free. It's on your iPhone and you just download that, or it's already on your phone. Have you ever used, Brittany, do you have an iPhone or a?
I have an iPhone. I've honestly not paid super close attention to the health app. I used to have a Apple Watch that had some kind of app on it, and I think it might have been the health app, and that helped me a lot with reminders of going to the gym and taking my vitamins even too. It helped me with that a lot. So I think that there is some kind of reminder you can set up in that health app to remind you to go either to the gym or just get out there and do something, you know.
Absolutely. I'm like looking to see on my phone if I can
If anyone in the chat has anything that they'd like to share, like any other apps that they use that's worked for them, go ahead and comment too, so we can learn some more.
Oh, absolutely. Yes. See if anybody says anything. Also, there's devices that track your steps. The one I just mentioned earlier, that health app, you can pull it up and it'll actually, if you have your phone with you, it'll track your steps automatically. Fitbit, Apple Watch. You know, I'm just mentioning a few. I already talked about these at-home workouts. at home workouts on your own. So you could actually work out, like have your own little physical activity. Maybe you meet with a trainer and then they devise a workout for you that you can do at home. And then, find little bits of time, maybe between I have commercial breaks, get moving during the commercial breaks, use the resistance bands. We talked about those a while ago. That's really helping with strength training. And then walking. That's something you can do outside or inside. And then other options, gym memberships. A lot of gyms right now are also going virtual or they have modified their schedules to accommodate all different types of times. Like let's say you work night shifts and you need to go, at a different time than most people, or you work and you want to go really early before most people are there. So there's all different kinds, and then gym activities outside and gym equipment at your home. So those are all just kind of suggestions. And I'm going to kind of pause here for a moment. I'm going to go back to our main screen with me and you and just kind of see if there's anybody here on our call that wants to say anything. See if there's anybody.
No.
Let's reach out. Not yet. Okay. We got a quiet bunch tonight.
That's okay.
The next thing I want to mention here, I'm kind of toggling back and forth, but you know what? I'm going to stay on screen, but I'm going to talk about journaling. Okay. So we're next going to talk about looking at what's best for you and really getting really intentional about if this is something that you're wanting to do, like a physical activity of some sort, finding what's right for you. So the main thing is looking at your goals and your why. So why are you wanting to do it? Is it that you want maybe increased muscle mass? Keeping your muscles and tissues active can help, with your metabolic rate. It helps burn calories more quickly. And maybe it's toning. Maybe as you lose weight, again, we kind of talked about help to promote the elasticity and the definition of the skin. And then help you keep more younger looking. If you look at people who are physically active and as they age, you'll notice that a lot of times their physical appearance actually looks healthier. And I think that's partially too because you're getting more blood supply to those cells more frequently, and you're basically more active. Basically, you stay healthier, you stay stronger, so you appear more youthful and healthful in that type of way. Kind of stumbling there, my words. And I guess basically also increased energy. We talked about that a while ago, getting your blood flow and oxygen to the places that needed those tissues. And for me, one of the biggest things right now, and I will be totally honest, is decreasing stress. When you're physically working out, a lot of times you feel more at peace, especially if you're outside walking. To me, you're at one kind of with nature, and it gives you a time to kind of sometimes be by yourself and just kind of regenerate a little bit. Were you going to say something, Brittany?
I was just kind of like self-reflecting a lot, is even if that's not the intention, if you go out for a walk or a run or walk, whatever, like, I have 2 dogs, so I take them for walks all the time. And when I'm out, I often just find myself just kind of reflecting about my day and thinking like, oh, and it's just nice to kind of be by yourself and have alone time too.
Absolutely. It's almost like it gives you time to breathe. Yesterday.
Exactly. Yeah. That's what I was trying to say. Sorry.
Yes. No, what you were saying was perfect. Yesterday afternoon, we live on a farm, and we have a few cattle, and we have some donkeys and all different kinds of animals. And I went out to feed them because my husband was getting home late. And while I was out there, while I was filling up their water tanks, I thought, you know what, I'm going to just take a short walk. And as I was walking, I was like, wow, I really need to learn to breathe deeper, because it's like all day long, you're thinking about things, and it's like you don't really take the time to just kind of relax your body. And I know that sounds kind of weird, relaxing while you're walking, because you're actually moving and having physical activity. But like taking you can pick up your pace and like really just breathe in, hold it for a little bit, and breathe out. And it's incredible. I mean, it just gives you that kind of peace of mind. I know it sounds pretty simple, but sometimes the simplest things are the best.
Very true.
Yeah. I am gonna be showing you guys something here. I'm gonna go into my handouts and I want to show you a little journaling exercise that I have. And I like to call it an empowerment plan. Now, if you were with us with our last session, we kind of talked a little bit about the same type of idea. I may just share my entire screen because it just makes it easier. Okay, we're going to that. And what I'm going to do is go to, oops, apologize. Here, journaling exercise. Okay, so with this, it's about, I hate using the word goals because to me that always, it's kind of tired and worn out a little bit. But what I want you to kind of think about here is kind of what you're wanting to create. So with this, SMART goals are basically goals that are SMART. They're specific. So you have the S for specific. So basically, who's involved in the goal? What do you want to accomplish? Where is the goal to be achieved? M stands for measurable. And that just means, how do you know if you've reached a goal? What kind of indicators can you tell? Really for just progress, how you're progressing, kind of those things we talked about. It could even be, kind of sound silly, but even the sore muscles, you know that your body is getting, your muscles are being built because you have that feedback from your body. They must be achievable. So it's something that you want to do. So if you say that you're going to work out 5 days a week and really that isn't realistic for you, I mean, obviously the recommendations are what they are. They're recommendations. But even if you're able to start small and maybe do 1 day a week or 2 days a week or whatever it is, wherever you are, it has to be achievable. So kind of just putting that out there. So the next thing is realistic, which kind of it basically says the same thing. It's a goal that you can reach and you're able to commit to in some sort of fashion. And then T stands for timely. Does it have kind of a deadline or how do you want to achieve it? So those are just kind of little basic things when you're talking about goal setting. But we're going to go down here to an example of a little, I call them empowerment plans. And we, like I said, if you're with us with our last one, we made one for whatever our topic was last time. And so this time there's an example, and down here there's actually a place for you to do your own. So if you decide to print this out, and you could just do it on regular paper too if you want to grab a piece of paper and just kind of start thinking about this little bit. The main thing is this middle column where it says overall result. That's where you want to kind of focus your attention on first. And basically, what are you wanting? Are you wanting toning? Are you wanting to be have more strength? Are you wanting decreased stress? Really, whatever's important for you, because your why is the main reason that motivates you and inspires you to do anything. For me, my recent reasons for kind of doing physical activity was that I wanted to kind of feel a little bit more toned, and I just kind of wanted to feel a little stronger, and actually the decrease, to help decrease my stress levels and just help me feel more peaceful, kind of time to kind of more commune with nature. I talked about that before. For me, those were my big whys. I just wanted to be able to just feel better, basically, overall. Brittany, when you're walking and that type of thing, or your physical activity, what is your main reasons? Do you have certain reasons?
Usually it's when I just need to break because, I work from home, so it gets pretty overwhelming just being in the house all day. I mean, it sounds silly, but it is. It's lonely, and I do it just because I need a mental break, I think. So it's kind of a good, like I said earlier, it's just a good way to get out there and clear your head and think about things alone, really, and kind of figure out what your thoughts are, because kind of like what you said earlier, it's hard when you're busy and you're just doing the day-to-day things to remind yourself to just stop and think about I don't know, just what your thoughts actually are. So that's kind of why I do it.
Yeah. And I
And
think
it's
a
good
lot of
for
people
me,
are,
so I probably should do it.
well, and I think you just kind of work it into your schedule, what works for you. What I found since, and there's a lot of people out there that are working remotely. Is anybody out there that's on the call doing that right now? I mean, it's very likely that a lot of people are kind of in the same situation we are. I'm working
I
from
think so, yeah.
home as well. And, um, it's just the times have changed. So a lot of times I find myself during the day taking a break and just kind of getting up and walking around my house a few times. I mean, it sounds kind of silly, but it's just enough
Yeah.
to kind of get me kind of moving and get my
Well, I
body
do that
stretched.
too if the weather's really bad or I don't, or it's freezing outside or if it's not suitable to go outside, I'll get up and just kind of walk around too. And
Kind of do, yeah. So I mean, that's your overall reason for doing this is the most important, that middle column. Okay. And then to start taking small steps, and I kind of got a few little action steps to kind of help you kind of start thinking about this a little bit. Maybe it's that you don't even know for sure what you really want to do as far as physical activity. Start researching it,
Mhm.
yeah, and you can put a timeline on it, plan by next Friday that you're going to have some research done and you're going to be looking at different. Maybe it's that you want to research if you want to do YouTube or some type like that daily burn or something like that, or maybe you want to talk to a trainer. It's about figuring out what works for you in your schedule. And then maybe it's working it in. The number 2 here, it says I kind of 1 and 2 are kind of basically the same, but it also might be planning a time, like what time of day. For me, like thinking about that is really important, because otherwise if you don't plan it into your day, it doesn't happen. It kind of slips by easily.
Yeah.
That probably is one of the hardest things for me, the biggest barriers. I don't know, making
No, I agree.
scheduling it.
I think for a lot of people will agree with that too, is finding the time.
Yeah. And then maybe it's making an appointment with a trainer. It could be penciling in the times and dates. I have a bunch of stuff here. Being increasingly aware of why you're doing it. And then I have starting a meditation practice. Meditation is not necessarily physical exercise, but it's helping your brain rest so that
Hmm.
it's, to me, it's a type of exercise in a different way. And then over here on the right hand side, overall purpose. So on a 1 to 10 scale, what do you really want to see at the very end of this so that you can measure your outcome? So do you want to see physical health? Do you want to see more confidence? Do you want to feel more powerful, more strong? Do you want to have more higher levels of energy? So I always like using a rating scale because I'm a nurse. We always say rate things on a scale 1 to 10, 10 being the highest and 1 being the lowest, whatever. So the higher that your level of wanting something is, the higher that your body's going to be pushed to do that, because again, that's your motivation level. If you don't have motivation, you're not necessarily going to want to do whatever it is to get started. So on those handouts, you have a little place for you to be able to do one of these exercises on your own, or you could just use a piece of paper and just kind of start writing down some ideas with that. And really and truly, that's going to be the basis of this program. I think the big things is what we're talking about here is we want you to be able to track your progress. I think it's really important to take inspired actions. If you're doing something that just doesn't feel right to you, you're not going to want to do it. Continue to be persistent. So not letting small distractions stand in your way, and then recognizing even the little results that you've had as you kind of start your journey as far as physical activity.
Yeah, because little results in the end, they add up to big results.
You say that, and that's so true because I don't know if anybody on this call has ever written a book called The Slight Edge. It was written by I'm trying to think of his name. Kind of my mind went blank, but it's called The Slight Edge. And basically, what it is it's a book on building momentum. And as you build the momentum, the ball rolls faster and faster. It's kind of like you have this ball going down the hill. At the beginning, it's starting to roll fast, and as it moves, it goes, you just build that momentum. Does that make sense? So,
Yeah, no, it makes sense. I've not read that book, but I know exactly what you're saying.
yeah. So I think that's with physical activity. You know, if nothing else, it could be just starting, like I said, starting some of those little points, starting to research maybe what you might like to do. It could be starting to take a walk. It could be maybe finding a friend. Sometimes if you have a support system with you, sometimes that makes it easier. So there's all different kinds of things. And then kind of going back to the recommendations, the average recommendation was 150 minutes of activity along with strengthening and toning. That was for pretty much all three groups. I think that the young adults, like teenage years, they recommended 60 minutes. But I say, start wherever you are. Make it doable. You can always build up if that's something that you're able to do, and do something that you enjoy, because if you don't enjoy it, likely you're not going to continue it. Would you agree?
Yes.
And then perfection.
But also don't be afraid to try new things, though, because if you think you're going to hate something, you might not. Just saying.
And I think too, what happens is exactly what you said. Sometimes we're scared to try new things because we might not know how we might be perceived or how other people might look at us. And I think perfection can keep us stuck.
Or
Yeah.
what we think perfection is. Yes.
Absolutely. So use setbacks as motivation to continue move forward while continuing to focus on kind of what you want in that. And I'm just going to kind of open it up to kind of some questions and answers right now before we we got a little gift here from our sponsor that I want to talk about here in a moment. But I want to just see, Greg says, hi support group, I like the idea of writing it down.
Brenda and I are both big fans of writing things down. Well, and what is it that people say? If you put it out into the world, it's more likely to happen to you. What is that? You know what I'm talking about?
Oh, like manifesting, like if
Yeah,
you're
like
creating something
self-manifestation.
on
And
paper, you're
yes.
creating the idea and the thought. All of those are energy. So like you're basically you're putting the starting points out there so that you can better attract the answer, and it kind of just sets you in motion. It's
Yeah.
almost like we were talking earlier. Aaron is a big fan of sticky notes. I am too. Do you use sticky notes, Brittany?
Oh, yeah, they're everywhere right now. Yeah.
So I honestly write stuff down so that I can check it off sometimes. That's bad,
Well,
but
and it's such a good feeling to check it off too.
yes, it is. So
Just, I
that's
don't
kind of
know.
a list. I mean, this, if you look at making this little journaling exercise something that you do, it's almost like a checkoff point. It kind of helps get you started and going. I'm looking to see if we have any questions. I don't see any questions. What I'm going to do too here now is I'm going to kind of type in those couple things that my daughter mentioned. And honestly, I have not. I'm going to put workouts on YouTube. I have not done these. I am not a sponsor for these, but I'm just putting them out there because she swears by them. Workouts on YouTube. So we have Chloe Ting, free program. We have Pamela Reed, or Reef, and we have MadFit. So those are just a couple ideas. Don't blame me if they're not good. I don't know.
Well, they're free though. It's,
Yes, there is a few of them. Then also, I want to kind of say from our sponsor. Our sponsor is ProCare Health, and I'm going to just kind of just talk just a little bit about them too. I don't know, has anybody that's out there heard of ProCare Health? If you're on this, likely you have, because you were brought to us likely in some matter
somehow.
of fashion. Anybody? Everybody's being so quiet tonight. I'm also going to invite anybody else. If anybody else wants to get up on screen and say hi, we would absolutely love that, wouldn't we, Brittany?
Yes. Yes. I think that the last person that did it, I think her name was Sarah. She was so sweet.
Yeah, I wonder if Sarah's with us today.
I don't know if she is. Hi.
I'm looking to see. Okay, well, I'm going to put our sponsor, again, is ProCare Health. They are giving us a 15% discount on products. And so that is, Brittany, you want me to type it in? Support.
Oh,
15.
I got it. Oh, okay.
I don't know if that helps. Maybe I'll let you type the whole thing, like a link and stuff. Would that help? So guys, if you decide that you want to check out products, I'm going to show you here real quick. Of course, I'm a lover of ProCare because I work with them, but I want to share a little bit about them. I'm going to go here to the website just to kind of show you their website. Oh, we're going back to the page we were a while ago with the handouts, but let's go to their products. I'm going to kind of check out some of their products here if you aren't familiar with them. So they're they have a 1-a-day multivitamin that is amazing. It's just 1 a day. You still have to take calcium along with it, but it's a 1 a day. They also have a probiotic version. Now that one is 2 a day, but it has your added probiotics. A lot of people like probiotics for gut health. If you have struggle with constipation, if you struggle with kind of GI issues, bloating, that type of thing, a lot of times probiotics can be helpful. Sometimes there's even been some studies that say that it can help accelerate weight loss too. So I am going to go to also on products, we have calcium supplements. I'm super excited because we have 3 flavors now of our calcium products for those of you who don't know. My favorite of these 3 is this calcium sea salted caramel.
Oh,
It's
yes.
right here. But there's a cinnamon roll, it reminds me of like a little cinnamon roll treat in the mornings.
The cinnamon roll one's my favorite.
Is it?
It's my favorite, yeah.
And then dinner mint. It kind of has a pistachio kind of minty flavor. I like eating those after.
Yes.
Kind of reminds me of that. And then there's an Up Cow, which is powdered calcium. And then, oh my God, people go crazy over this calcium dark chocolate. It
will be restocking very soon. So keep an eye out for an announcement because it will be very, very soon.
Yes, thank you, Brittany. So it came off the shelves for a little while over the summer months because it's too hot to ship. Wouldn't you? Is that the main reason?
Yeah, it just doesn't transport very well in the hot months.
So we have that, and basically, get on here and check everything else out. There's some protein supplements. We even have a little hand sanitizer down there, but just all kinds of. And if you haven't tried ProCare, come up here to a free sample.
Yes.
And put in your information and have us send you a free sample. Those are for anybody, anytime.
And we do have a resource page that has so many blogs on there. If you guys are looking for any specific information, you can always go to the website and click on our resources page, and we probably have a blog for it.
We have lots of blogs. But
it's good though.
Yes. Well, today we had it a little shorter, and I'm just so glad that everybody joined us. And this is available for replay, so if you decide to come back, the handouts again, we have those, the link for that. Check those out if you want to access those later. And so I don't have anything else really to say. Brittany, do you have anything else before we close?
No. Just keep an eye out for the chocolate restock because I know that's it's a lot of people's favorites. So I know people are really excited that it's coming back. I'm excited it's coming back, but yeah, that's really about it. And then also I almost forgot, we will be having a Black Friday and Cyber Monday sale as well. So look out for more information on that. But I think that's it. That's all I wanted to share.
Good.
Thanks for having me though. I really appreciate it.
Well, you added to the call. It's much better seeing your pretty face on here than just seeing
Oh.
me here. Anybody else has anything else before we close? You're welcome to just say something. But if
And then
not,
I think if people ask a question afterwards, won't we get an alert?
you know what? That's a good question. Let's
think-
try it. Ask us some questions after this is over and throw them out there, and we'll see if we'll see if we can respond on those. So we may have to be a little test for this time, but
Michael said, nice support group, stay well. That was very nice of him. You stay well
thank
too.
you.
Happy Thanksgiving to
Yes.
everyone too. Because that's very soon. It's in like a week, right?
It is. Oh, and one thing I want to bring up too. One of my favorite things to do over the holidays, like Thanksgiving's one of them for doing this, but I love if you can get together with your family. Sometimes people with this season they aren't always able to get together, but call some of your family members and see if they want to bring walking shoes along. We love my family. After we eat this huge meal, you almost feel miserable if you eat too much, you know. So we like bringing our tennis shoes along and taking a walk instead of taking a nap. So that's what we usually do. And if the weather's nice enough and we're able to this year for Thanksgiving, me and my family is going camping. So we're going to do a lot of hiking and stuff. So I'm looking forward to that. But I mean, that's just an idea. With any of the holidays, you can do that. You know, if it's not too cold or not bad weather out, but it kind of gets you out and talking to your family and your friends if you want to talk to them. There's been lots of together time with all of this going on.
Yeah.
Okay, well, I guess we're going to close, and thank you, everybody, and thanks, Michael, and thank you, everybody else who said hi to us and who shared this call with us
Oh,
on
and
the live and replay.
one more thing. So the link that Erin just shared is a really helpful blog. It's a new blog. We just posted it, I believe, early this week or later last week, but it's tips on making Thanksgiving healthier for you, and it's also has some pretty good tips in there for people who just had surgery, I believe. So
Yeah, thanks for saying that. Also, one other thing I want to mention too is on this specific ProCare has a channel like this where you're on right now, this Crowdcast. It's on the ProCare channel, and if you follow us with these events, you get notifications about upcoming events. So we've been doing live presentations. I just did one on portion control, and that is on our channel. That was a live presentation. So there's tons of other topics and live presentations that have been on replay. But if you follow us, you'll get little notifications, and you can change your notification settings anytime. But if you want to try that, you just kind of go into the ProCare Health channel and here on Crowdcast and follow us, so we can see more of each other. So I think that's it. Anything else? Anybody? Okay, we're gonna end the call. You guys all have a great evening.
bye, guys.
Bye. Thanks, everyone.